Emergency room costs in the USA for tourists. Real numbers. Most tourists believe that an emergency room visit in the United States costs a few $100s. That belief feels logical, especially for travelers coming from countries where healthcare is subsidized or governed. But in the United States, that assumption can turn into one of the most expensive mistakes a tourist ever makes. Emergency care in the USA is among the most advanced in the world, but it is also among the most expensive, and tourists pay the highest price. The American healthcare system works very differently from most countries. There is no universal healthcare system, no standard pricing, and no fixed cost for emergency treatment. Every hospital sets its own prices. Every doctor bills separately. Every test, scan, medication, and procedure is charged as an individual service. When a tourist enters an emergency room, the billing process starts immediately, often before treatment even begins. The first charge tourists usually see is the emergency room facility fee. This is the cost of using the emergency room itself. Even if you only speak to a nurse or wait briefly, this fee applies. In most U.S. hospitals, the facility fee alone ranges from $1,000 to $3,000. This fee does not include treatment, tests, or medication. It is simply the cost of being admitted into the emergency department. After registration, a doctor will evaluate the patient. This consultation is billed separately and can cost between $500 and $1,500, depending on the hospital, the doctor's specialty, and the perceived complexity of the case. If a specialist is called, such as a cardiologist or neurologist, additional charges apply. These fees are not optional and are added automatically to the bill. Diagnostic tests are where emergency room costs escalate rapidly. Blood tests are standard in U.S. emergency rooms. A basic blood panel can cost $200 to $500, while more detailed tests may cost significantly more. Imaging tests add another layer of expense. An X-ray can cost $500 to $1,200, while ACTA scan can range from $2,000 to $5,000. An MR, if ordered, can exceed $6,000. These tests are commonly ordered even for conditions that turn out to be non-serious. Medication administered in the emergency room is billed separately. Simple pain relief, anti-nausea medication for fluids, or antibiotics can add hundreds or even thousands of dollars to the final bill. Tourists are often shocked to see medication charges that are higher than the total hospital cost in their home country. Now imagine a common scenario. A tourist experiences severe stomach pain or chest discomfort while visiting the United States. Out of fear, they go to the emergency room. Doctors run tests to rule out serious conditions. After several hours, the patient is discharged with no major diagnoses. The visit feels short and uneventful. A few weeks later, the bill arrives. The total cost is $8,000 to $15,000. This is considered a routine emergency room visit in the USA. For more serious cases, costs rise quickly. If the patient requires observation or is admitted for even one night, the bill can increase to $20,000 or more. Hospital rooms, nursing care, monitoring, and additional tests are all billed separately. If surgery is involved, costs can escalate to $50,000 or higher within days. Tourists pay more because they are usually uninsured within the U.S. healthcare system. Even if they have health insurance from their home country, it often does not apply in the United States. Hospitals classify tourists as self-pay or uninsured patients, which means they are billed at the highest possible rates. Another reason costs are so high is out-of-network billing. Emergency room care often involves multiple providers: the hospital, the emergency physician, the radiologist, the laboratory, and any specialists. All bill independently. Even if one service is covered by insurance, others may not be. Tourists without U.S. insurance are responsible for every charge. Ambulance transportation adds another layer of cost. If an ambulance is used, tourists can expect a bill between $1,500 and $5,000, depending on distance and level of care provided. Ambulance services are often billed separately and are not always fully covered by basic travel insurance. Many tourists assume that hospitals will treat them first and worry about payment later. While U.S. emergency rooms are legally required to provide stabilizing care, billing always follows. Hospitals may request deposits, copies of passports, or proof of payment ability. This creates stress during an already frightening situation. Some tourists try to rely on credit cards to handle emergency expenses, While credit cards can temporarily cover payments, they do not reduce the cost. High interest rates, repayment pressure, and currency conversion fees can turn medical bills into long-term financial burdens. Others believe they can negotiate the bill after treatment. While some hospitals may offer limited discounts, negotiations are unpredictable and rarely reduce bills significantly for tourists. Many hospitals expect full payment and may pursue collection efforts internationally. Emergency room visits in the USA are not only for severe trauma. Conditions like food poisoning, dehydration, allergic reactions, infections, and minor injuries frequently result in emergency visits. These situations still generate large bills, even when the patient is discharged quickly. Time spent in the emergency room also affects cost. Longer stays mean more monitoring, more staff involvement, and more charges. A visit lasting 3 or 4 hours can result in a bill equal to several months of income in many countries. The reason emergency care is so expensive in the USA is rooted in the healthcare system itself. Hospitals operate as businesses. Pricing is complex, opaque, and varies widely. There is no single national pricing standard. Costs are influenced by location, hospital type, and administrative overhead. For tourists, this system is particularly dangerous because there is no safety net. There is no government subsidy. There are no negotiated insurance rates. Everything is billed at full cost. Many travelers underestimate how medical bills can affect future travel. Unpaid medical bills can lead to debt collection efforts, impact future visa applications, or create complications when returning to the United States. Ignoring the bill does not make it disappear. This is why understanding emergency room costs in the USA is not fear-based messaging. It is practical education. Many travelers only learn these numbers after facing financial shock. Travel insurance plays a critical role in managing these risks. With proper travel medical insurance, many emergency room costs can be covered or reimbursed. Without it, tourists are fully exposed to the financial impact of the U.S. healthcare system. However, not all travel insurance policies are equal. Coverage limits, exclusions, and conditions matter. Some policies may cap emergency coverage at amounts that are too low for U.S. medical costs. Others may require immediate notification or use of specific hospitals. Tourists often assume that travel insurance automatically covers all emergencies. That assumption can be dangerous. Policies must be understood before travel begins, not during a crisis. Emergency room care in the USA is excellent. Doctors are highly trained. Technology is advanced. Outcomes are often positive, but quality comes at a price, and tourists must be prepared for that reality. Understanding real emergency room costs allows travelers to make informed decisions. It helps them choose appropriate insurance coverage, plan finances, and avoid panic during emergencies. The goal is not to avoid emergency rooms when care is needed. The goal is to avoid financial disaster after receiving care. Traveling without understanding medical costs is like driving without knowing traffic laws. You may be fine, or you may face severe consequences. Preparation transforms emergencies into manageable situations. Ignorance turns emergencies into long-term financial problems. Every tourist planning to visit the United States should understand one key fact. Emergency room care can cost more than the entire trip. Planning ahead is not optional. It is essential. These costs are not rumors or exaggerations. They are real, documented, and experienced by travelers every day. Knowing the truth before traveling can save years of financial stress. Travel should be about experiences, memories, and discovery, not medical bills and debt. Understanding emergency room costs is part of traveling responsibly. Preparation does not remove risk, but it reduces consequences. That is the difference between a medical scare and a financial disaster. If this video helped you understand the real cost of emergency care in the United States, make sure to subscribe to this channel. Here, we break down real travel risks, medical costs abroad, and insurance realities, so you can travel informed and prepared. In our next video, we'll explain another important topic every international traveler should know before leaving home.